Million people affected by peanut allergies. In the most severe cases, sufferers have to scrutinise absolutely everything they eat or even touch for fear of a fatal allergic reaction. It's a really
it's
tough
just
one,
very
isn't it?
tough one to live with. Richard Gaisford is in a laboratory in Cambridge this morning with news of a major breakthrough. What have you got for us, Richard?
Well, I've got some peanuts, and this is what they've used to come up with a solution to this problem. They've got peanut flour from the peanuts and are giving very small amounts of it, building up tolerance to peanuts in peanut allergy sufferers. And what it means is not only can the children eat the nuts themselves, but suddenly a whole world of food is back on the menu for them, stuff that may well have killed them if they'd eaten it before. And Dr. Andy Clark is here with us now, and from this small lab, it's a world first.
Yes, peanut allergies is a really huge problem in the UK. It affects about 500,000 people. We've shown that at least 8 out of 10 children can adapt to eating peanuts safely again.
And it's a bit like an immunisation. You've given them the ability to eat peanuts.
That's right. We give them a really tiny amount to start off with, such that it doesn't cause a problem, and then over 3 or 4 months we build up so that by the end of it they can eat peanuts every day and not have to worry about checking labels, and this improves their quality of life.
And by doing it, I mean, it sounds quite simple, Andy, but I wonder whether you should be doing this at home, trying it for yourselves.
Absolutely not. This requires a large degree of specialist oversight, and it would be very risky to do at home, so you mustn't.
But the patients you've had, it's changed their lives?
Yes. Universally, they say it's dramatically improved their quality of life.
It's brilliant. I met a young girl yesterday who can suddenly eat donuts, and it's just changed the way she looks at food.
Absolutely. Thank you very much indeed. We're now joined by 14-year-old Anna, who's benefited from the therapy, and her mother Francesca, along with our health editor, Dr. Hilary Jones. Good to see you all. Your daughter had a huge reaction to peanuts when she was, what, 3 years old?
She was 3, yes.
What happened?
We were on holiday in Gran Canaria. She had some peanuts, maybe just 1 or 2. I took them off her because you don't give young children peanuts. And she began to swell quite quickly afterwards. Breathing became quite laboured, and she was complaining of hearing loss. We had to rush her to clinic to be treated, and then on to Las Palmas, where she was treated by doctors there. So it was all quite dramatic.
So you've had to live with this for the last 14 years. What's it like living with a peanut allergy day in, day out?
It's really, really difficult because you can't eat everything you want to eat. You can't go out without the worry of having a reaction, and it's just really difficult.
It can't be normal, I suppose.
I know, and going round to your friends' houses must be really difficult as well, because they'll have to, you know, I'd be panicking, I'd be thinking, oh, right, and I can't serve that, and I can't serve that, and it just makes, it just makes life really, really tough. So
it's really, really good because I can eat pretty much everything, and I can go to my friends' houses as well without like having to worry, and I can go out without having to worry.
Sure.
And I can go to restaurants and eat anything as well.
Wow. Of course, that's the other thing, isn't it? Yeah, and you must have, it's amazing how many things, when you start to look at labels, how many things have got nuts or potentially might have nuts in them. That must have just been your life, just studying things all of the time. And it's right in being different to everyone else, isn't it? You just want to be the same as all your pals.
Yeah.
It's good. Hilary, this is a huge breakthrough, isn't it?
It is. I mean, immunotherapy of this kind has been looked at for many years. They've used liquid drops, they've used all sorts of ways of desensitising, or trying to. But this is the largest trial of its kind and the most successful, dramatically successful, with an 84% success rate without really any safety issues. Only 1 out of 99 children had a reaction, and that was easily dealt with. But interestingly, part of Anna's ongoing treatment with the desensitisation is she has to have 5 peanuts a day now to keep the desensitisation.
Whether you want to or not.
What do you have them for breakfast or lunch?
So that has become the problem, has become the treatment. So it's really dramatically effective, and hopefully in years to come this will be rolled out to be made available to everybody. It's not something you should try at home, because when you think about it, 1 peanut contains 250 milligrams of peanut protein, and they start off with 2 or 3 milligrams, so tiny, tiny amounts in a flour, which is made into a mousse, put into a yoghurt, and then the dose is increased in hospital under supervision every couple of weeks. And it's really worked for you, hasn't it? It's completely.
Anna, what's your favourite food now that you couldn't eat before that you can now?
Chocolate.
Oh, really?
Obviously.
Ask a silly question.
Results.
Obviously. And you can just eat it in a wee yoghurt at breakfast time and that.
I have it after school because
that's really good.
it's easier, and then I just have the 5 peanuts, like whole peanuts, and then it's really good.
Brilliant. I'm glad to hear it. It's a really exciting breakthrough.
You still carry an EpiPen?
Yeah.
Just in case. Just in case, just to be on the safe side.
That's been a way of life for years, though, hasn't it? So,
Thank you.
Yeah, really good to talk to you.
Thank you very much.
And thanks, Hilary.
Thank you.
Matthew Wolfenden and Natalie Anderson have taken a break from Emmerdale to bring you this week's fantastic cash prize of £36,000.